Welcome everyone. We are the U21 Health Sciences group. We are glad of being here today on the third day of this event. My name is Silvia Olivares and I'm the Academic Dean of the School of Medicine and Health Sciences from Tecnológico in Monterrey. We are really glad to be host of this event. Here we are going to start with this session. We are having 3 moments during this session: a plenary, academic excellence with social accountability in COVID times with Dr. Klaus Püshcel from Pontificia Universidad Católica de Chile. Then we will have a panel, future implications of social accountability, also with Dr. Klaus Püshcel, with Dr. Cynthia Villarreal Muraira from Tecnológico Monterrey and Dr. Marcio Gomez from University of Ottawa, and myself as a moderator from Tecnológico Monterrey. At the end, we will have opportunity to have questions and answers from our panelists, but also I want to encourage every one of you to send their comments and questions through the chat, both during the conference and during the panel. So I want to introduce Dr. Klaus Püshcel. Dr. Klaus Püshcel is full professor and director of the Center for Medical and Health Professionals Education at Pontificia Universidad Católica de Chile. He completed his residency program in family medicine at Pontificia Universidad Católica de Chile and holds a master's degree in public health at the University of Washington in Seattle and a master's degree in bioethics at the University of Leuven in Belgium. Dr. Püshcel was the director of the School of Medicine at Pontificia Universidad Católica from 2014 to 2018 and chaired the Department of Family and Community Medicine from 2008 to 2013. He has worked as a clinician educator in primary care for 20 years, combining clinical practice, medical education, and community-based primary care research. Of course, he's also a good friend of mine, and I'm really glad of having here today Dr. Püshcel.
Thank you very much, Silvia. It's a great pleasure to be here. Thanks a lot.
So right now we are going to watch a recording video from the conference of Dr. Klaus Püshcel. Ricardo, if you can help us to share.
I want to, first of all, thank Silvia Olivares and Jorge Valdez for this invitation, for this presentation, this important event, and on academic excellence and social accountability during these COVID times. My name is Klaus Püshcel. I am a faculty at the Catholic University in Chile in the Department of Family Medicine. And I am also the director of our Health Sciences and Medical Education Center. And it's really a pleasure to present this topic. I think it's really particularly important in our region in Latin America, where we have a big problem of health disparities. So I will start showing some information on that, and then I will address the main elements associated with social accountability and a framework that we developed a couple of years ago with a group of experts from Latin America that has been useful for us to address this topic. And finally, I will give an example of how we have used this framework to tackle some of the issues that came up during this COVID-19 pandemic. So let me start showing you the importance of the COVID-19 pandemic in our region. As you can see, these are data from last year, and the three countries with the highest mortality rates were from Latin America, and there were also countries from our region that were in the top 20 with the highest mortality rates. And situation has not been changed much. And these are data from this week, and we can see that mortality rates have been very high still in our countries, and that has brought a lot of course of burden and consequences for our communities, but also social consequences, and the social and health disparities have increased as a consequence of this epidemic, as it has happened in many countries, but especially has been a strong effect in Latin America. So it's not only COVID, as we all know. Here are there's some information on fatality rates associated with cancer subtypes, comparing Latin America with other regions in the world. You can see that fatality rates for every cancer is higher in Latin America compared to other regions. Same thing happens if we look at cardiovascular diseases and heart failure, hospitalizations, and mortality. We can see that Latin America is leading these consequences in terms of mortality and heart failure compared to other regions. So we do have important interregional disparities in Latin America compared with other regions in the world in many diseases. But we also do have health disparities within countries. These are data from Chile, and you can see on the left of your screen that cancer mortality rates are much higher, almost 10 times higher in women with very low educational level compared to women with high education level. And on the other hand, we can see that survival rates from myocardial infarctions are also very different when we compare women with high socioeconomic status or low socioeconomic status. So we do have important health disparities within countries in our region as well. So on the other hand, there has been a strong growth in the number of medical schools in Latin America during the last 2 decades. And it's very clear if we look at the numbers of medical schools in the 80s, 90s, and in 2000, you can see that almost double in the last 5 years if you compare it to the 1992 or 88. And currently, 16% of medical schools worldwide are from Latin America. So really an important increase. And so we wonder what has been the contribution of all these medical schools, of these new medical schools in the region to reduce health disparities and to improve the healthcare system. Of course, this is not a particular question for our region, and it has been asked many decades ago. Probably one of the first times that this issue was brought up was in 1995, and Charles Bellen raised this question and published this seminal document on the definition and measurement of social accountability of medical schools. And I think two of the main points of that document are here. He stressed very clearly that medical schools both shape the health system and are shaped by it. So emphasizing the interaction between medical schools and the healthcare system. And it was very clear that medical schools have the duty of demonstrating social accountability, because in a way they frame the social contract of the medical profession and the healthcare profession in general. So it was at the time very important to be very explicit on the role of medical schools in the whole healthcare system and the contribution they must do in this area. Another important moment, I think, was the global consensus for social accountability of medical schools that many of you might know, of course. And this was in 2011. Unfortunately, only 3 from the 65 representatives that wrote the final document were from Latin America. So again, we had there representative inequality. But when we talk about this and we explore the issue with our colleagues from Latin America, we realize that we haven't really addressed this issue in a systematic way. And it was very clear for us that we had a lack of systematic reflection on social accountability of medical schools in our region in Latin America. So we had work to do, and we had to tackle this issue. So we put a grant to answer this question: what makes a medical school socially accountable in Latin America? And we here at the Catholic University gather a number of academic leaders from the region, and explore what were their experiences, their perceptions, what were the main dimensions, the main components of social accountability in our region, in our particular reality. And the panel did really great job. We divided this study in 3 stages. The first was the qualitative phase, where we explored this issue, and then we conducted a Delphi consensus method approach to identify the main elements of a future instrument that we finally developed to assess social accountability in our medical schools in Latin America. So what were the main components, the main dimensions that our experts defined and identified? Well, three main dimensions at that point: the political dimension, the societal dimension, and formative dimension. These were the 3 main dimensions that they thought were important when we talk about social accountability. And the political dimension meant that medical schools have the duty to be involved systematically in the design and the development and the implementation of health policies. They should be part of national health legislation, health practices regulation at the regional and institutional levels. And this was probably an emphasis that had not been so clear before in the previous frameworks that had been developed. So I think it was important for us, and it was probably a contribution that this panel made to the whole topic of social accountability. Then the societal dimension involves things such as social-oriented research, community engagement, and the formative dimension includes things such as admission criteria to assure diversity in students, in the student community, curricular structure, role modeling, professionalism, etc. So we finally developed an instrument which was based in the final version, was based on 4 dimensions. So the panel thought that mission and quality improvement should be explicitly present in the final instrument. Then public health policies, community engagement, and professional integrity were the other dimensions that finally were included in the 21-item instrument that was called SAIL, so Social Accountability in Latin America, Compromiso as we call it in Spanish. And this was the instrument that we finally developed, and we applied to a number of medical schools. After that, about 50 medical schools, more than 100 of representatives answered this instrument. And interestingly, we found that among the top 80 medical schools in Latin America, most of them were not ranked in the same top 80th percentile when we consider social accountability. So most Latin American medical schools ranked in the top 80th according to the traditional standards that is contained in the QS ranking system, were not in the top 80th percentile when we consider social accountability. And this was important information for us to see that we were measuring different dimensions, and if we want to include social accountability as a dimension of excellence in a medical school, we should probably use a different instrument. We should add a different instrument that the traditional instruments we use to measure excellence in medical schools. So let's go back to social accountability and the COVID-19 pandemic, and let me share with you some of the initiatives that we have developed within this framework at the Catholic University in Chile. I'm sure you all have a lot of great experiences and also probably dramatic experiences during these 2 years. But let me share with you some of the initiatives. So the initiatives were concentrated in these three dimensions: public health policies, community engagement, professional integrity, that we thought were essential to fulfill the mission and that we defined for our medical school, considering that social accountability is part of it. So having these three main dimensions that are contained in our SAIL instrument, we took a public health perspective and reflect on what could be our specific contribution from our university to the public health system, to the national public health system, given all the initiatives that the government was of course developing. And so we defined some concrete initiatives using a public health approach. In primary prevention, for example, we defined that we could contribute in immunization and testing new vaccines for addressing the pandemic, using our scientific network and our contacts that we had for a couple of years with the Chinese scientific community. We also defined that we had some expertise in environmental issues, working with our engineer faculty. So we decided to work on ventilation standards, for instance, at schools. And in secondary prevention, for example, we defined that we were going to contribute in early detection for screening and early interventions, developing models for clinical support in primary care. We defined very early on that any initiative and any new program that we develop had to have an impact in health policy. So we design interventions thinking that we need to escalate them at the national level to make it feasible to be applied in different communities. And so we had that in mind. And so we participate, but also integrate these initiatives in the national task force that the government developed early on in the pandemic in Chile. We also consider that this experience should include our academic community, students, faculty. We had to be very careful on self-care on our community. In our community, we wanted to serve, wanted to learn, so we developed some initiatives to improve that learning in a very, very difficult environment, as you all have experienced as well. So, and finally, we knew that we had to look for funding, because we learned in the past couple of years that social accountability is not free, that if we would really want to work on it, we have to have funding. And so we look for public funding from public agencies, but also funding from the private sector. In the case of Chile, we applied for a grant with on a mining company. Mining is very big in Chile, and as you might know, has been doing very well last couple of years. So we got a grant from a mining company that we used to develop some of these initiatives as well. So some of the examples we have worked on: early detection and early treatment in primary care. We took advantage of our strong primary care network that we do have in Chile, and we do have at the university. We do have a primary care network at the university. So we tested a new model for early detection. We developed a number of initiatives in community testing. Probably you guys did the same thing. This nice bus that we can see here was we got the bus from our grant as well, so we could work with the community and with the students, with the faculty, helping doing testing and trying new initiatives for improved community testing. But we also develop a clinical model at primary care and treating patients with COVID pneumonia that were not very sick, and at the primary care clinics and at their homes with oxygen, trying to reduce the overloaded emergency services and hospitals that we had, especially last year. So these initiatives were escalated then at a national level. Many primary care clinics also developed this model and develop a strong home-based model for treating patients with COVID pneumonia and with oxygen at their homes, connected with the primary care clinics. So a nice model, and that escalated at a national level. Let me give you another example. We very early on realized that testing was key in this process, as the whole world was telling us. And there were a number of rapid serologic testing, you probably know this, in the market with a very, very variable profile and different sensitivities and specificities. So we were not sure if this was something that we should implement at a national level. So we decided to conduct a trial to test these serologic tests. And finally, we got the results that they were not effective. So we made a strong recommendation to our government not to use rapid serologic testing in primary care. We did find that antigen testing were much better, and now we are using antigen testing in primary care for rapid diagnosis, and in some cases we're complementing that with PCR. So this was a contribution in terms of early detection and screening. And in immunization, in primary prevention, as I told before, we use our networks with the Chinese scientific community, and we conducted a trial to test the Chinese vaccine called Sinovac, because we were not sure if it was effective or not, and we needed to we wanted to test it in our country, so to see if it was feasible to use it or not. And the results were published recently. We knew these results, of course, a couple of months before. The vaccine is effective in reducing the incidence in about 60–65% and reducing mortality in about 80 or 85%. And so the Sinovac vaccine is now being used generally in our population. We also use the other ones, but this one is not the best one, but it's good enough and has had some effects already in our population. So we think it was a good contribution to define a national health policy. Finally, let me share with you an initiative in the learning environment. Of course, we all had to make big adjustments in the medical education. We developed this distance-based simulation program with a new platform called C121 that allowed us to train professionals from all across the country, different places, in different topics. This is an example of 1,000 participants that were enrolled to manage COVID-19 consequences, and they had the opportunity to upload the training videos, and then the experts provided feedback, and students could review that feedback and do it again. If they fail, they have to change some things, and it has been a very useful platform that we are using now, also for our students and for professionals across the country. So a number of examples in the different dimensions of our framework, more related with health policies, with community engagement, with medical education. And this is the situation in Chile now, but of course we know that it's not over yet, and we probably will have a new outbreak soon with the Delta subtypes, the Lambda subtypes. So we have a lot of work to do still, and we have to be ready for that and do as good as we can. But I think with all the suffering and disruption of this pandemic, we had the opportunity at least to serve our community better and to be involved. Using the SAIL framework, we really think that this service to the community should be part of our mission, should be done in partnership with our local communities, should impact health policies, and so the initiatives should be designed thinking on that they have to impact health policies in a way, and it should contribute to professional integrity. So thank you very much, and I hope this presentation can help for our future discussions, and I would love to hear your experiences as well. Thanks a lot.
It's always a very interesting topic and a very interesting talk. I understand, Dr. Klaus, that you want to share a slide to explain a little bit more about this.
No, Silvia, no, go ahead with the questions, and if the opportunity comes, I can share another experience from our forum that we had in June, but just part of the discussion. So go ahead, please.
Okay, so I want to introduce Cynthia Villarreal. She is Director of Sustainable Development and Engagement at Tecnológico de Monterrey, where she leads the university's efforts to become a model sustainable institution, as well as promoting social innovation at Tech and throughout the Spanish-speaking world through the Stanford Social Innovation Review. She holds an international business degree from Tecnológico de Monterrey and a master's degree in public policy with a political and economic development concentration from the Harvard Kennedy School of Government. Welcome to this panel.
Thank you.
I also want, yes. I also want to introduce Marcio Gomez. He is Associate Professor of Pathology and Distinguished Teacher at the University of Ottawa. He obtained his medical degree, completed his residency program, and his PhD at the University of Sao Paulo. Dr. Gomez is a clinician educator in the specialties unit of the Royal College of Physicians and Surgeons of Canada since 2017, where he works with the development of new areas of focus, competence, and competence by design. He is also a regional advisor for Latin American with Royal College International and participates in many international partnerships for the development of residency education. Dr. Gomez, welcome to this panel.
Thank you. It's a pleasure to be here. Thank you, Silvia, for the invitation.
So we have like several things to think about in regarding this topic of social accountability. But what do you think about we as healthcare professions and schools should address this topic during the program, and if we have to change something after the COVID crisis? And I'm going to go first with Dr. Cynthia Villarreal, then Dr. Marcio Gomez, and then Dr. Püshcel.
Thank you, Silvia. So I think, first of all, I'm very honored to be here. Thank you for the invitation. Thank you, you, Silvia, and Dr. Jorge Valdez. Regarding your question, I think that we all felt, we were all shaken, we were all overwhelmed. Our lives drastically changed, our lifestyles have changed with the COVID pandemic. But when we see or talk about COVID as an isolated issue without accounting for other global issues, I think maybe our vision will not be complete. So in that sense, there are other global issues besides that, and very related to the COVID, such as climate change, that have and COVID obviously that are pushing us to urgently change our lifestyle and change and transform basically the way we think and act. And to achieve this change, obviously we need new skills, we need values, we need attitudes that can lead us to more sustainable societies. And obviously, medical schools are a very important actor in this sense. And what I'm trying to say is that if we take a look at these problems from a systemic perspective, we should see that medical schools are one important actor in a very big ecosystem of actors that involve many more institutions, whether they are private institutions or private companies, public government. We're also talking about, obviously, civil society, civic society organizations, and the population in general. So I don't know how much time I should take to answer this question. I can go on, but Silvia, please let me know how I should sort of answer. But I guess this is my first introduction as to how our perspective should cover more than just COVID, because there are other very important things going on in the world, and we should also see medical schools, but from a systemic perspective, and how we are connected to other organizations that are playing a very important role, and how we cannot think as an island, especially with these type of global issues that require a very big interaction and collaboration and partnerships from many other types of institutions.
Yeah, thank you. So we are a big network, we are a big world, and we should everyone to contribute in some way to the situation. So Dr. Marcio, what is your perspective?
Thank you, Silvia. So I have 2 points I think that I would like to address first. So should we change after the COVID crisis? I think if we look at a number of frameworks, and Klaus talked about a few of them in his presentation, we know that there are great frameworks that cover social responsibility. The biggest problem is to make them happen. It's just like constitutions. Constitutions and legislation, they're beautiful on paper. Much more difficult to make them happen. And in medicine, in medical schools, the way that we try to make it happen is by a strong system of accreditation. Strong system of accreditation that has 2 main roles: approve and improve. And when I say approve and improve, is approve having the power to close schools or to make sanctions if things are not the way they should be, as determined by health policies and educational policies. That's one. But more important than that, a quality improvement system, a continuous quality improvement system where when we identify issues in medical schools, we address these issues. Klaus was talking about the number of medical schools that have opened recently in Latin America. And we all know that it takes time to develop a medical school, to really be able to create a strong curriculum, and it needs time for quality improvement. We're just in the change now to a paradigmatic change to competency-based medical education. And that's gonna require many years of quality improvement. It's an innovation in medicine, and it's not ready yet. So this is my first point, and I think accreditation is really the social accountability of schools. The accountability of schools to society is having a strong accreditation system. The other point that I would like to mention is COVID was an unknown unknown. It's different from climate change, for example. It's happening, and what are we doing about that? But what's going to be the next COVID? It's going to be unprecedented, and it's going to be unpredictable, because if it was not, we would have done something about it. But it was unpredictable. It was unprecedented. So I would like to address another point that we discussed at the last IMELF LA, which was the matter of adaptability. I think we need to work really hard on being adaptable, any school, because that's a necessary skill in this rapidly evolving world where there are many unknowns. And that's what I would like to say. Klaus, please, over to you.
Well, thank you very much. Yes, and I think I totally agree with Cynthia that we need to be more probably systemic approach, not have this reductionist approach, right? So, and I think it was very clear during these times the importance of having this more ecological perspective as well, included in our idea of social accountability. And I also want to thank really Marcio, because he mentioned IMELF, that we have this International Medical Education Leaders Forum in June, just in June. And you remember, Silvia, you were there. We asked kind of the same question: what has changed? What will remain? And I think, and I want to share this just one slide with you to show what were the conclusions of that, because I think it can illuminate this discussion as well. So let me share these conclusions of that forum that we had. Can you guys see that?
I just have my glasses now.
Okay. So
Yes.
this forum gathered about 55 representatives from 30 different medical schools in the region, also Canadian representatives, and Marcio was there as well. And I think the beauty of it is, we ask kind of the same question that Sylvia is asking us now: what has changed, what will remain? And the first reaction of most of us was this idea of chaos, right? So we were not prepared, as Marcia said. And we learned in a hard way how important adaptability was in a real scenario. We all know this in theory, but now we did have to adjust, right? And we had. I mean, most of our institutions had to adjust, and new skills were developed in a more systematic way. And we are having now telemedicine. We're having virtual sessions. We're having virtual encounters. The residents, the students, they assume a new role, much more with a higher level of protagonism, and of course this humanism idea emerged with very strongly, I think, right? So we need to take care of each other. Not only it's not only the patients, it's not only the healthcare team. It was also our peers, also the environment. I mean, we need to have this collective self-care approach that was not, I think, so strongly developed before. A new idea of wellness came, that most of our participants said that, and we were having a new challenge in terms of how to assess, right, new competencies, new abilities in this new virtual scenario that we are teaching now. We are sharing experiences. So just to highlight what Marcio was saying, this was really unprecedented, and I think we are still transitioning from chaos to a more systematic approach. But also, as Cynthia was saying, we can see new things, right, from our small spot, right? We need to broaden our perspective. So that was, I think, my main point here. We'll stop to share this.
I mean, it's an interesting review of all the topics that are considered and what we need to change and need to address in the future. But what I hear from you is maybe we were so focused on having this approach on patient-centered before the pandemic. But now I'm hearing about, it's not just about the patient, but it's about also the self-care of the professionals, and also the care for, the environment, the care for. So what I was thinking, hearing of you is, wow, we as curriculum designers, we have this huge challenge to put so many contents and so many awareness and habits for the students in order to change their perspective to themselves, to the patient, to the society, to the environment. So I need some advice from you. What would we should do in order to put like all these topics together in a one curriculum? So what do you think about this? How can we start? Doctora Cynthia.
Thank you. I'm not a doctor, but I am very happy to be surrounded by doctors. But regarding the curriculum and the frameworks that we can maybe at least explore, there is a concept that's not new at all. In 2015, the United Nations They adopted the 2030 Agenda for Sustainable Development. And this is a global framework and that's trying to redirect humanity towards a sustainable path. No? And it obviously, it's addressing a range of social needs, including education, which is our topic, but also social protection, job opportunities, health, at the same time tackling climate change and environmental protection. And in this sense, there is the United Nations through the UNESCO, they have developed a framework for education. It's called Education in Sustainable Development. And it has been, actually we at Tech are right now in the process of exploring with the deans of the different schools, including the School of Medicine of Monterrey, of how we can implement this type of framework into our existing curriculums, right? So, for example, this framework, it focuses on competencies. It talks about system thinking, or it tries to through the curriculum, it tries to insert systems thinking competencies, anticipative competencies, normative, strategic, collaborative, and critical thinking. Also self-knowledge and integrated problem solving. So in this sense, what this framework is trying to do is to enhance the cognitive, the social, and the emotional and behavioral dimensions of learning, to empower learners with different skills, but also values and attitudes to be able to make informed decisions and to make responsible actions for throughout their careers. So I think this is very worthwhile to explore that. In short, it's called the ESD, and it's really a basis of transformation of society. And medical schools, I think, will be I mean, health is an objective. It's one of the 17 Sustainable Development Goals, but it's linked to each of the 17 goals. So in a sense, it's very, as we were saying, and I just want to say it one more time, it's very difficult to disconnect health from poverty, health from environment, health from hunger, health from, each of the, even peace, right? There's a Sustainable Development Goal on peace. It's connected to everything. So medical schools and teaching medical students a sustainable, or giving them this framework and these competencies, I think it's a very important pathway to transformation of our societies.
Thank you. And talking about competences, Dr. Marcio, I know you are an expert in this field. Can you help us a little bit from your perspective? What about the social responsibility and how to address in what competences, since it's like a big framework from several things, as I just heard from Dr. Cynthia? What do you think about this?
So first, I'm not familiar probably with the framework that Cynthia is talking about, and I would love, Cynthia, if you could point me to the right direction. For sure, I think it makes a lot of sense. It's holistic, and I think that Cynthia talked about twice the importance that health has within a broader system. And that is really important for us to address, because if we think on how we develop curriculum in competency-based medical education, we need to start with the context, with the health needs. So if we don't start with the health needs of society, you're not going to get to a curriculum that will address the needs, the local needs of the communities. So we also need to start with that. And that is in a broader concept. But when we develop the system, I would like to focus on the political dimension that Klaus talked about. We practice within a business model, within an economic model, within a healthcare delivery model. And depending on, and like we have determinants of health, we're going to have determinants of practice. What I mean is, the way that this system is modeled is going to be how physicians are going to practice. And one of the strongest things that we know is culture. Culture eats a strategy for breakfast. And that culture, that professional identity that relates directly to the professional integrity that Klaus was talking about again, it's going to determine a lot on how we're going to role model, how our learners are going to learn from us. So even if we come with the best competency-based curriculum, but we don't have the alignment among society, economic models, business models, practice models, we are not going to change the professional identity, the culture within medicine. And we are not going to be able to address the health disparities. So the notion of equity needs to pervade, needs to be in every place. Knowing that we need to, in equity, we need to give more resources to those that have less, and make society agree to that. The broader society, not only physicians, but the broader society agree to that perspective is difficult and requires a lot of political will. And so I think this is something that we cannot detach. Healthcare needs are within a broader system, and we are impacted directly the way that we practice, and students are going to be impacted by the way we practice what we value. So we need to focus on values. What do we value as a profession? And make it clear in public policies, in public health policies, but also in institutional policies within medical schools, within healthcare centers.
Wow. So what I hear is that we impact, each of our students and their nurse professionals have their own impact. But then as institutes and schools of health, we do have impact on others. But then, since we have connections with the healthcare system by clinics, we also have impact there. And since the health helps impact everything, so we are really responsible for so many things. Dr. Klaus, what do you think about this?
Well, I think I'm anxious now, right? Because I think our next paper should be called something like "From Framework Back to Reality," right? We have all these frameworks, as Marcia said, but now we need to change something, right? So, but I think both of them they brought great points here. One of the things that I want to emphasize is that the framework helped us in terms of organizing the fields, the dimensions where we wanted to work. We knew that there was a formative part of it. We knew that we needed to work with the community, with the local communities, and we also realized that we had to impact at a more broad level in terms of health policies. So when we use this framework to try to collaborate in this pandemic, we probably had these three dimensions on mind, and also we knew we used these two principles. First, anything that we are going to try, formative, community perspective, or more broad political perspective, should have this idea of affect policies. So we needed to work with real people, with real decision makers. That's why I think our faculty, our university, was part of this national task force, and we of course were very proactive to be there, to really expose yourself to a group of people that might think differently, that have other values, maybe that it's competing with you. But if you want to make change, you need to be in the decision making field, right? So we knew that it was not just about research, was and you know, testing new things, was about, you know, changing the reality through putting those experiences in a group that had the power, you know, to make decisions. And I think that was a main part of it, right? And the second thing is that okay, we're going to be in the group that is going to take decisions, but we also knew that we need resources for this. I mean, we couldn't test new things, formative or, you know, community based or participatory, or if we didn't have resources. So we knew that we had to apply or to look for funding, look for resources, institutional or outside. I mean, I really think that you cannot do social social accountability strategies if you don't have resources for those. I mean, you will need to put together, you know, a task force maybe to test pilot things, you know, changes, to evaluate them, to assess the changes. You will need resources for that. I mean, of course, you know, we all know this, but we need to be proactive, looking for those as well.
So what I hear from here is that it's really important so the students and maybe the faculty engage in more tasks related to health policies regarding to try to get involved in some of the changes. I mean, not just being like observators, you know, observants of that, you know, also as participant of the change. But what do you think about the social responsibility of the healthcare centers? We connect to several of them through our, you know, as medical and health schools. And what do you think about that? What do they have their own responsibilities? But what is about the connection that we have with them? Should the students also be involved in that part, the faculty, or just respect what is going on? I don't know. What do you think about this? Cynthia?
Thank you. I saw Marcio had his hand up. I don't know if...
Okay, Marcio.
Okay.
No?
Okay. So regarding this social responsibility, I'd like to illustrate with examples that we have done at Tec de Monterrey. Tec, for example, created the Tec Salud Foundation with the specific mission of supporting low-income people in medical and hospital care through health centers. And what's important about this is that it's run with the support of students from the School of Medicine and with clinical professors. Some are volunteers, and with donations. We're connecting to what Klaus was saying. Donations and links to government entities and other charitable organizations. So in this sense, what Tec is doing is connecting funders, using this power we have as a big university to connect with the private sector to try to use this convening power or philanthropic sort of push that we have been trying to position at the university to fundraise for this foundation. And this foundation, well, it has been important for COVID, for treating people that would otherwise not be able to have access to healthcare. And also at the same time, for trying to through this fundraising, if there were a couple of cases that were very that were how do you say, graves, they were very, very ill. So they through the support of some fundraisers, we were able to take them to Tech's private hospital and treat them. So I think this again, this connection of actors using government, using private sector, especially private sector for fundraising, and charitable organizations, we can act as conveners to do this. I'd also like to illustrate with another example, and Klaus was also sort of talking about it in Chile, what happened in Chile, but in Mexico as well, we had research protocols and for CureVac vaccine, with over 1,500 volunteers. We also had cell therapy protocol in partnership with Novocell Biolab in South Korea. And we also had a convalescent plasma therapy research and as well as running campaigns for donors. So it's using our capacities in terms of medical, technological, and human to sort of act and be co-responsible for what is going on in society. And I'm talking about in COVID, but Tech Foundation has been running for years. So at the same time, it's helping students obviously learn more and be more proactive in this area. So I think those two examples or three examples are
great examples. Marcio.
Yeah, I'll come back to the issue of context. I think it's a very important issue here. So I'm in Canada now. I used to be in Brazil. There are two different realities. You were all talking about health center and medical schools, which for me, like in Brazil, they were quite distinct, separate entities. Here in Canada, there is a lot of overlap. So your academic hospital is connected to your public hospital because the system is public, and the public hospitals are connected among themselves, and there is only one, there is the Ministry of Health that is gonna supervise the whole educational system and health delivery system. So it is a different context. It's a different context, like in the way that as soon as we, not as soon, but after we had the chaos that Klaus talked about, it was how can we redistribute resources within the larger system. So not within our hospital, but within the larger system. But I think that the barriers when you have a system that is already interconnected, that already has these relationships and that you have the same boss, it's kind of a little bit easier for you to integrate everything. There is, I would say that there is less conflict of interest. I'm not saying it's easy. I'm just saying it's different. That's one thing. If I take my experiences in Brazil, where we have one of the highest number of medical schools in the world, and per population is also one of the highest, and also the number of different healthcare delivery models that we have in Brazil, business models that we have in Brazil, it's unbelievable. And how you're gonna integrate the system becomes much more complex when they are not, the whole structure of this healthcare delivery system depends on such a huge number of stakeholders. So I will use an example. When I practiced in Brazil before moving to Canada in 2005, and I was working in a private laboratory, we would have a list of things that we could do depending if the patient comes from A, B, C, D, E, so. And of course, those that had more resources had more services provided, and those that had less resources had less. So it's the opposite of equity. It's the absolute opposite of equity. So what I'm saying is, coming back to this, I think that the same principles that apply to medical schools should apply to healthcare centers. So we shouldn't have a breakdown between the two. Of course, we cannot change things, and Klaus, I think he put it really well. So yes, there is a good framework, but there is an utopia, and we cannot move from an ideal framework from utopia from night to day. We need to go through a process of continuous quality improvement, and those frameworks are great. But I think that what we need to work towards, where we need to move towards, is a system where both healthcare centers and schools have the same principles of social accountability applied.
Thank you. Dr. Klaus.
Yes, Silvia, I think this is a great question because, I do think that as universities, as part of the academic world, we are challenged by reality, right? So we need to look for ways to be much more immersed in the reality of, the challenges of the day to day, right? And this pandemic, I think, taught us that it was, it was really something that we had to do. I mean, so how we do that, how we contribute in a meaningful way, how we I think that's the challenge, right? And I do think that the more social accountable that the institutions will be, the more connected with reality. That's a survival competence for the institutions. I mean, I do think that we need to be connected to the healthcare institutions, to the healthcare system with all its limitations, and problems, not just sending students to learn, not just sending them, to our university clinics that are small, in general, and cannot take all the students we need to. So we need to be much more connected, much more, and I think this was an opportunity to do that, right? And it was amazing, I think, for the healthcare system as well to realize that they also can adjust. I mean, it was very interesting, right, for us to see how we change type of beds, and we transform IQ beds that we didn't think we had before, right? And so we double or triple, the number of intensive care unit beds, and I think that was a general thing in all our countries. And also we started to do virtual consultations in primary care and telemedicine, and it was also a general thing with all these limitations of resources, with the clinics and all the things that you of course experience as well. So I guess my point is that we at the university we had to adjust, for new learning strategies, but the healthcare system also adjust, to provide services that were needed, in a different way than before. And I think in this process we also found new interaction ways, right, between the academic world and the healthcare system world, and I think we need to take advantage for that, and and to make it real, moving from the frameworks to the real interaction, and say, okay, how are we demonstrating that we are involved, in the healthcare system, and vice versa, right? What is the healthcare system providing us as academic institutions, right? So. So I do think we experience changes, in both sides, in the academic world and in the healthcare system side as well.
Thank you. Well, very, very interesting, all the situations where we need to be more integrated, more connected, more engaged, more concerned to the same objectives, to the same topics. Right now, I would like to invite all the audience to make their own questions. They can start with the chat, but we are going to put in some breakout rooms, one per panelist, in order to have a closer conversation about these topics. There are like a list, I have here a list of concerns, but right now maybe the most important thing is how to prioritize, where to start, what are our own concerns about this as universities or healthcare centers, or maybe in your own context of each one of us, maybe one of the people from the audience want to share something. And well, Ricardo, please help me to put 3 breakout rooms, and in order to keep this conversation closer with the audience. Also, I want to tell you that this is the last day of U21 Health Sciences. We are really glad in this journey, 3 days of a lot of activities. We also have a later mezcal tasting, which is a great opportunity to learn more about the Mexican culture And also it involves with alcohol, so you're going to be,
Is it
you're,
virtual?
it's a workshop, yeah, mezcal tasting. Yeah,
That's the best part, right? It's the best part of the encounter.
agenda. Yeah, and of course we have at the end of the event the closing remarks in order to wrap up a lot of topics that we were discussing during this day and going. Ricardo, how are we're doing with the breakouts?
We are ready, Silvia. You will receive
Okay.
the notification.
Thank you. I'm pretty sure you were really interesting talking and we interrupted your conversation.
Yes,
Yes, you
you
did.
interrupt us, Sylvia. We were in the middle of the discussion with
We may go back. Ricardo, help us to go back. I'm not sure if we can go back wherever we were. It's not too hard. And maybe we
No, it's okay. Whenever you
That's
decide.
fine. It's fine. It's fine. We were talking about the importance, Sylvia, of trying to push that this idea and this framework translates in a real accreditation instrument. So to make it happen really, if because if not, it's still very altruistic and that's fine, but it's not enough to change. I think the perspective of medical schools. We need to include this in accreditation processes, and of course it doesn't depend of any one of us in particular, but we can all work on that idea, I think.
And I have and I was going to put a question to Klaus and Arnoldo. We were very suspicious that you send the old guys to a specific group because we were Arnoldo, Klaus and myself. But I will leave it at that. But the question that I was going in, and I will take advantage that everybody is here, Cynthia and Marcio, and the rest of the colleagues, is on. And they ask, I think, I don't know if Klaus mentioned and somebody during the different core meetings, what is the role of the medical school and the university in this to be social accountable? Do we need, is our role to organize groups that influence the society? Do we encourage them? When we draw the line that this is what we have to do as a university, this is more for the society to do. And actually, I have an email this morning. Somebody wants, and I will direct it to Cynthia, asking you, I have these 3 initiatives to change in the law, to organize something new. Is our role as a university? That's my question for Klaus, Cynthia, Marcio, and the rest of the people who want to answer. You want to get it, Klaus?
Yeah, that's a hard one, but I do think it's our role, Jorge. I do think that we need to be, as Cynthia, I think, said before, we need to be key players here. Of course, we need to be careful in terms of the political side, but we need to take a risk. I mean, to change things, it's impossible to do it from the outside. I think we need to be very clear on what we are. Right, we are not a political party. We are a university, an academic institution. But I think we need to encourage and influence the changes in terms, for example, of public health issues. Because there is a lot of knowledge that we do have, and it's not enough, I think, to share it, but also I think to really convince others to implement what we think is better. And of course, this is a dialogue. It's not that we are the only ones here, but to encourage, I think, the interaction and to be active players. I do think that we need to be careful as university, as the industry of the universities, as a whole, to don't lose importance. I mean, if you see, for example, where the vaccines were developed, I mean, most of them were not at universities, right? I mean, most of them were outside them. And we have a number of examples here that we need to be involved as the industry as an industry, right? To be key players and to don't lose our I think our place, right? To be involved. I think we need to be very active on this. That's my perspective. Of course, it's there may be others.
I agree totally with Klaus, and obviously medical schools and universities are not solely responsible for the social environmental problems that we have right now, a health problem, but for sure we are part of the problem, and we should be part of the solution. And to answer also, Jorge, what you were saying about we cannot participate in everything that's coming towards us, right? Join these initiatives, but there are I think we should leverage more on partnerships and alliances, thinking this is may sound as a cliche, but thinking globally and acting locally, this is what medical schools should and universities in general should do, right? Being part of local alliances, multi-sectorial alliances that involve governments, local governments, that involve civic society organizations, and obviously private sector at the local level, and also at a global level, to be able to exchange best practices and yeah, I think that those are my 2 points.
May I add something? I agree with everything that was said. We are political agents. We have agency. We need to execute that. I think it's part of our role, but not our main role. One thing that I would just like, because before in our group, we had a question that I liked, is medical education to students has changed, because, and not only medical, healthcare professionals in general has changed because they could not be face-to-face with patients. So what do? I think it's very important when I mention adaptability, and I will come back to that, is who told us that this is not going to be the new normal? Who told us? We don't know. Our healthcare needs were different before COVID. And now we are adapting to different healthcare needs, which might be temporary, but might be not. More than that, we don't know what is the next, using a term that is known to many, what is the next black swan that is going to come? What is the next unpredictable? So adaptability is important, because even this whole structure of medicine into highly specialized healthcare centers and specialties and etc. might change in the future. We don't know. We're always thinking that the past is going to be the future, but that's not necessarily true. We are seeing a lot of changes. So I just wanted to come back to adaptability. Adaptability needs to be a new core skill. I was taught, I volunteer to vaccinate people. I am a pathologist. I didn't give a vaccine for 20 years. And then who taught me? A resident. Who taught me to give vaccines again? It was a resident. So this adaptability is very important. And I would like to just end my participation with that.
Thank you very much. We are coming to the end of this session. Very interesting. So many topics, because of course this topic covers a lot of perspectives from political, society, environment, the education itself. So I think at least myself, have a lot of to-do lists, a big to-do list in order to address all these concerns in our medical and healthcare programs. So thank you very much, everyone. Good morning, good evening, good night, wherever you are. And we would like to invite you to our next conference, which is the core meeting session 5, and the last one for the core meetings at 10:30 in Monterrey, Mexico. And we are having a really good discussion about leadership, so stay tuned, and we'll see you in a little bit.
Thank you. Thank you, everybody.
Thank you.
Thank you so much.
Bye-bye.
Thank you so much.
Bye bye. Gracias, Silvia.
Gracias, Doc.
Gracias, Silvia, Jorge, Klaus.
Bueno, gusto
Ha sido un
verlos,
placer.
Cintia, Klaus.
Marcio, un abrazo. Jorge, un gusto.
Yo,